Good morning, doctor. Welcome to this interview.
Good morning, madam.
Thank you for sparing time. Dr. Anil Manorama Madhavrao Diwan. His father was a popular headmaster in Parbhani district. Mother was a domestic engineer, I mean homemaker. Dr. Anil is blessed with two sons. Both are software engineers. Even their life partners are also software engineers. Dr. Anil's wife is a yoga therapist. Dr. Anil's personality to describe it is his personality is in his name spelling. A stands for he's able and affectionate person. N stands for he's a navigator and very noble. He has very innovative ideas and always takes initiative to do the social work. L stands for he's loyal to his profession, to his family, and as a son, as a father, as a husband too.
Thank you very much, madam.
Dr. Anil also is proficient in chess. When he was in medical college, he was selected as a Senate member. He was also on Board of Studies of Human Development and Family Studies Department of Vasantaranak Marathwada Agricultural University. He was selected for 2 terms. He contributed innovative ideas in developing the departmental research projects.
Very kind of madam you because I got that opportunity because of your affection.
Uh, it is always based on your professional contributions only university chooses doctor. And doctor also was involved in extending help to the orphans and underprivileged children in Parbhani in various institutions. Doctor, when I got to know that you are very proficient in chess, can you just describe about this chess hobby? How did you develop, and what did you do?
It is fortunate that I have played many sports. I am interested in all sports activities. But since childhood, in my home, my elder brother taught me chess. I got opportunity to play for my college, medical college,
Okay.
for university level and became champion there.
Uh-huh.
But after coming to Parbhani, I became the member of this Parbhani Chess Association.
Okay.
And since last 20 years, we are conducting the many camps as competitions, and I am serving and also playing there in such competitions.
Okay.
Because of this, my chess
Hobby.
my both sons also became
Chess
chess players.
champions. Okay.
They also played at many competitions
Uh-huh.
since childhood.
Okay.
My younger son started playing in national competitions since the age of 7 years.
My goodness.
Still, they are interested and they are playing this chess.
I know that you were the executive body member of Indian Medical Association and also Indian Association
Academy
for
of
Academy of Pediatrics, IAP. Uh, that itself talks about your social service, because to work as an executive body member in a professional bodies, literally you have to give time to not only handling people, association members.
When I started practicing in Parbhani in 1987, it was a small union of doctors,
Yes.
Indian Medical Association. But the dedicated people were there, senior members, and they have made me initiative to take part in these activities. And they have given responsibility in very early times as a secretary of this Indian Medical Association. And then since last 35 years, I am associated with this academy and IMA association because the clinical activities, social activities, and the many new doctors coming here, and we are making a good association, and that is very healthy and good relations become because of this association in all doctors of Parvani. It is a very good thing that if doctors are in having good relations rather than rivalry, that will be benefited for them and also
Yeah.
for
Even
patients.
for the community also,
Yes.
they can unitedly they can contribute a lot.
And this is because of the senior consultants or
Yeah.
people in our association.
Mhm.
They have made this
How many years of practice you have completed
in this next
next year?
25. I am completing 37 years.
37.
Yes. In 1987, I started small clinic. Then I started indoor patients. From day one, I started indoor patient, but with Chaudhary Hospital. And after 8 years working there, I started my own hospital.
Then Chaudhary means gynecologist?
Dr.
Lady.
Madhukar Chaudhary and Dr. Mrs.
Both were
Manjari Chaudhary.
gynecologists.
No, Madhukar Chaudhary was physician
Uh-huh.
and Manjari Chaudhary.
So after the delivery, there only.
No, when I started practice, they have stopped maternity home,
Uh-huh.
so I couldn't get
Advantage of their patients.
hospital.
Uh-huh.
But main was their advice and their
Okay.
help to establish my practice. That is very much I should remember.
Even when 1981, when I came to Parvani, I used to hear about Madam.
Yes, yes.
It's very
She
popular
was
gynecologist.
first gynecologist
Most
of
of the
this-
university staff.
Yes, she was first gynecologist of this city.
Uh-huh.
But not only that, she
Very
has
good human
very
being.
social
Yes.
work for women.
Yes, yes.
She has
On
very
many
good- yes.
occasions, on the stage I met her.
Yes. Both the Dr. Chaudhary was also in
Yes.
politics also
Mhm.
and also in sports and many social activities.
Yes. Very active.
Yes, yes.
What type of experience you had from the beginning? Like young Dr. Anil Diwan as a pediatrician, now as a truly.
As a first doctor in the family,
Mhm.
it was my father's dream that you should become a very good doctor in Parvani. You should start practice or you should become a good doctor here.
Mhm.
As he was working in the government service, he initially thought that I should join the government service. And in those days, it was very easy. Even I got
Many of us.
appointment letter direct to my home without any interview,
Yeah,
without any
because
application.
Offices were badly in need
Yes.
of trained
Please join
professionals.
such and such PSC. But because of some reason or
You decided to
advices
start your-
from these senior colleagues,
Uh-huh.
it's better to start private practice. Even in private practice started, before starting private practice, I have got a call from MGM University, medical college,
Mhm.
from Mumbai to join their new hospital in Vashi. To
So it was
start-
very difficult for you to
Yes.
take decision whether to
start
join
the department of pediatrics there and you work
such a
there.
great offer.
The person came to my home directly and asking him to come there.
Mhm.
I went there. I have seen this college, the hospital, and when my father and mother came to know that I am thinking of going to Mumbai, as my elder brother joined Mumbai as an engineer and settled there. They also afraid that I will go there and I will not come back.
Uh,
When I came to know that they are afraid, so I decided to come to Parvani because at that time they were more 60 plus,
Yeah.
both were. So
They wanted at
Yes.
least one child to stay with them.
and I was also not that much eager to go to Mumbai for practicing. So I started in my own house. I started a small
A clinic.
clinic. Yes.
I remember bringing my UG and PG students to your NIC.
Yes, yes.
When did you start it and what was the need?
After I started from first day. I was admitting this newborn child in Chaudhary Hospital,
Okay.
but it was not a special unit.
Mm.
So in 1995, I started a special NIC. That was first
Was
NIC.
it the first one
First in
in Parvani City?
Parvani, yes.
Uh-huh.
Because till that time, even in government hospital, it was not available. And I have got good experience of working in NICU at Government Medical College, Aurangabad. So that with that experience, and I have got additional training at KM Hospital, Pune for this neonatology. I have started this, and along with my wife, Dr. Shubhada, we started caring this newborn. We were good support from all gynecologists, and specially mention my friend Dr. Ramesh Ahuja.
Okay.
He started practicing along with me,
Mm.
and right from first day, he has make a new suggestion. Every labor, every delivery, every Caesar should be attended by pediatrician. So I have to attend every child at the time of birth, and so we can have a good results. So that's why I have decided to start a separate unit, so we can take better care of these needy babies.
And Dr. Ahuja's clinic also is close to your clinic.
Yes.
So it was easy to give the best care to the neonates
As
in crisis time.
our Parvani is a small town,
Yeah.
it was very nearby clinics and hospitals.
The babies were lucky.
Yes.
You know.
we were lucky to have.
Both, yeah, but both, because as a child development person, I know.
No, Dr. Ahuja and myself are friends from school days.
Okay.
So we are now completing more than 50 years our friendship.
My goodness.
And that help in our relationship and developing the practice as well as making the patients happy.
Okay, this I didn't know.
Yes.
Uh-huh.
So that is a very good opportunity to work in our own village.
Doctor, in your neonatal care intensive unit, that NICU, when the babies were coming, were they hospital delivery babies or home deliveries? Because those days home deliveries were also common.
Yes. In 30 years back, it was home deliveries are more.
Yes.
Deliveries in the hospital were less.
Yes.
And hospital care deliveries were almost have less problems, premature or any disease or any distress. But home delivery babies were coming more, and because of that, early age marriages or no hospital medical care during ANC, we have to treat these malnourished babies, low birth weight babies, and having some maternal illness along with that.
Do you remember any one or two cases where the babies had very low Apgar score? And how many days it recovered and what type of administrative?
As I was attending these deliveries and cesarean sections, many times baby is totally asphyxiated. You can call Apgar score 0.
My goodness.
And we have to resuscitate that baby by artificial respiration and oxygen, and then you have to ship that baby to you. And I have got many experiences that such babies, as we are thinking that they will not survive, but they survive normally, and even their as immediate care was taken, their neurological function or their other functions are almost come to normal. But there are some incidences, babies came from home deliveries, totally neglected, and we could not make them totally normal, or many times
Yeah,
the
because
newborn
already sometimes irreparable damage is done in the uterus itself.
intrauterine hypoxia is more dangerous than this
Yes.
intrapartum.
What were the major causes of these babies who were admitted to NICU? Why they were premature and had very low Apgar score? What were the parameters of these mothers? Whether they were young mothers or malnourished mothers?
The main factor in those days was this early marriages. Mother's age was less than 20
Mm-hmm.
and they become pregnant. And other is nutrition. The care of this
Pregnant.
pregnant woman was not that much taken. Or even there are some socio-economic problems,
Yeah,
this
mostly.
low economy, and because of that also, this main party. And again, important factor was that they are not going to doctor for ANC checkup or
Yeah, prenatal
yes, prenatal
checkups were very
there
less.
very less. Even I will say that even
Educated people
yes,
also.
educated people also. And the other thing, the they marry to a very good city and they bring their daughter to their home for this delivery.
Okay.
Even having a good facility there at their in-laws,
Yes.
they also bring their daughter for
To the mother's
it
place.
was a custom
Yeah.
that first delivery should be at home.
Parents.
But,
Because the girls get best care
yes.
from the parents.
Or sometimes it is
Customary, that is compulsory.
economic problem or some
Okay.
social you should go there. It is
Uh-huh.
our dictum. You should not come there.
Yes.
But nowadays the changes are there. The government has also taken good.
Yeah, now awareness and the young
Awareness.
couple are now they're spending a lot on antenatal care.
But still, I am saying that is for
That
this.
not that much is not done.
Pre-marriage counseling is more important nowadays
Yeah.
because we are seeing many.
Yes, you said right point is
Yes.
pre-marital counseling, pre-parent counseling
Yes,
also.
yes.
Before they.
Because after marriage, when even after marriage, one should get a good consultation
Yes.
to have a medical checkup. Even your nutrition should be good before even conception. Also, I mean, not after conception.
Doctor, in the initial stages of your practice, what kind of common health problems the children had? Now, what type of problems are now current problems, health issues? Is there any difference or same old trend? Health issues
Yes, yes.
of the children.
Gross difference. A simple
Uh-huh.
example I will give you. We studied in medical college malnutrition,
Yes.
and in that we were studied malnutrition as low birth weight, low weight, not gaining weight,
Yes.
or weight is less. And now we are seeing the patients of malnutrition only, but that is the obesity.
Okay.
When we were started practice, we have to told parents that his weight is low, you give him good food. Nowadays, 5 years or even 3 years, boy is coming with overweight. So we have to.
So obesity you feel now
Obesity is now.
among your patients.
Yes, it's very much high.
So they
Now,
come for consultation.
they don't come for consultation.
They come for
If-
some health
yes,
issue you identify.
Even if we advise them,
Uh-huh.
he is obese, take care. They think that he is good health.
You have a good health
Why are you making him
to lose weight.
ill?
Uh-huh.
He is not ill. He is just having very good health. Even at the age of 2 years, we are seeing babies more than 20 kg.
Right.
At the age of 13,
What might be the reasons?
this is because of the change in habits, the food habits, junk food we call it, or even some
Hormonal, I feel even
Yes.
hormonal disorders are also.
hormonal disorders. We are seeing this early diabetes in adolescents.
So was there any correlation between the pregnant women and this obese kids because of too much hormonal disorders?
Yes.
If the pregnant women underwent for long period severe stress.
The as this pregnancy is now becoming a late age pregnancies
Nowadays.
nowadays, after 30, 35. they got this hormonal imbalance, and for that they may take treatment or may not take treatment. That will definitely affect these newborn babies. Because in early dictum it was that large size babies is in pre-diabetic mother or diabetic mothers we see. But nowadays not only diabetes but PCOD or other conditions, we are seeing that these babies are born premature, low birth weight, and after that they become obese. This is a very controversial thing, that baby born as low birth weight and within few years that baby will be in hormonal imbalance with obesity or other changes.
Apart from this, other health issues, what?
Yes, this is one example. In those
So
days,
either overnutrition or undernutrition, you said.
undernutrition, yes.
And is that because of this air pollution, water pollution,
Yes, yes,
other
definitely.
diseases are there?
In our days, when I started my practice, आमच्या कॉलनीमध्ये कॉलनीतले पेशंट यायचेच नाही आमच्याकडे. मग असं वाटायचं की आपल्याला इथं नवीन कोणी असल्यामुळे ओळखत नाही. त्यामुळे आमचे एक वडिलांचे मित्र आले. त्यामुळे तुमची कॉलनी एवढी हेल्दी आहे, तिथं कोणी आजारीच पडत नाहीत, मुलं तुमच्याकडे कशा येतील. म्हणजे दिस वॉज द सेइंग. Nowadays the change totally.
Your colony is full of.
Colony is full of vehicles, full of this pollution.
Okay. Yeah.
So these
So the colony,
allergic
yeah, less
conditions.
population was
Yes,
there those days.
population
Basmati
was
road.
less,
Yeah.
and it was greenery.
Yes.
Everything was there. Like that, in those days, more were infections. Water was not properly.
Water contamination.
Water contamination was there. And the more was this what we call the epidemics, typhoid epidemics, cholera epidemics. We have seen in those days. Many times we have to attend the government hospital to treat such emergencies because the overload of these patients. But nowadays, this epidemics are gone down.
Because of the immunization.
Immunization is most important in that cases. When we see such in that days, this viral illnesses because of this non-immunization, people were very reluctant. Nowadays, we have not seen many cases of this. Nowadays, we are seeing the more cases of this allergic and related to what we call dust.
Dust and this pollens also.
Yes.
This allergy is related to the seasons also.
Yes, seasonal
Children's
pollen.
allergy.
Seasonal pollen is very common with children. And in that days, children used to go to outside for playing. Nowadays, they are in so the deficiencies of these vitamins.
They are not built up.
Yes.
The resistance.
We were not seeing deficiencies of vitamins in that days very common.
Because children were allowed to play
Yes,
outdoor.
allowed to play, and they eat properly. What?
Yes, two things.
The fresh vegetables, fresh fruits, or whatever.
Now all instant
Yes,
fruits and
now everything is
packed food.
packed food, and even parents
Make it compulsory to have fresh
eat
food.
everything as per their choice.
Yes.
You can take whatever you want. You can't.
Child is not guided properly, you mean to
Yes.
say.
They start with biscuits and milk in the morning,
Yeah.
And
Bakery
they-
products.
and they sleep with pizza and burger in the night. That is the main problem.
Yes.
Problem was not that.
Uh-huh.
The educated, I was very comfortable with the illiterate people.
Yes.
Whatever we say,
They
will
believe
accept
that, yeah.
and they will do.
In every profession,
Yes.
we feel
And nowadays the
to convince the educated because they are misled by mass media and social media.
even they have no time to listen from us. What they just in hurry
Yeah.
They have very less time because of the working hours or whatever, and they think that giving medicine is just only important. The other advices about diet or about other things, counseling part, they don't want. They have no time.
Only medicine they want.
They just want one medicine today, if not tomorrow, new medicine.
Only.
If not that, new doctor.
So they're not interested in preventing,
Yes.
only on curative methods.
Or you can change the doctor.
Okay.
You can change the city also for doctors.
Yes.
With no doctor, good doctors in Parbhani. We consulted Pune, we
They go
consulted
there.
Mumbai.
They
So,
go. That is a psychological feeling. The
Yes.
more they spend, the more, the far away they go to the
Yes.
cities, they get the best facilities like that. Definitely, it is a misconception.
very, very.
Parbhani is blessed with many mature and intellectual doctors.
It is,
They are very devoted to their profession.
it is possible because of this train develop,
Yeah.
and the people are also good. They also
Yes.
have good faith in doctors. Just yesterday I met with my for consultation of my sister with a young doctor from Aurangabad. I was knowing his name, but I was not knowing he knows me very well. He told me that my relatives were your patients, and he is now studying in IIT Hyderabad. At that time, I visited many times to you. I was not remembering, and he purposefully making weekly visit to Parbhani because of this affection to Parbhani and the services to Parbhani. He is working in Aurangabad as a super specialist, but he still commute to Parbhani because my sister asked him, तुम्ही तर दोघं बरोबर नव्हता, तू तर खूप लहानच याच्यापेक्षा. तर तो म्हणे आम्ही ह्यांच्याकडे बघून आम्ही डॉक्टर झालोय, आणि आम्ही त्यांच्याकडूनच बऱ्याच गोष्टी शिकण्यासाठी परभणीत येतो म्हणून ही मेन्शन इन दॅट वे की
All of us are influenced by special personalities in our life. So you have directly and indirectly influenced many people.
I don't know that, but
Yeah, I know it.
it is indirect effect.
Yes. Doctors have special place in parents' heart.
Yes.
Because the
For
child is precious to them.
For pediatrician,
Yeah.
we have to face as a father, mother, grandparents,
Yeah.
and our relatives, because if a baby becomes ill, the whole family becomes panic.
Yes.
In our close relative, baby was born, and both parents and their grandparents from both sides were taking care of that baby. Even if baby started crying, all rooms came to see why baby is crying, and then it becomes a crying baby is abnormal, or crying baby is having some illness, and they started calling me, why baby is crying, you are not seeing, you are not taking care. I usually say that crying is their exercise, or their pranayam,
breathing
body
exercise.
breathing exercise.
If they don't cry.
Yes. And if they are not properly guided, they start many homemade medicines or whatever everybody advises, and even they go to doctors for only this, just stop his cry. Why he is crying, what is problem in feeding, or anything irritability is there. Even our professor, Dr. Diwan, he passed just few months back at the age of 92. We call him as a father pediatrician of Marathwada.
I met him once.
We have called many times here. he started Department of Pediatrician in our college, and he has trained almost all pediatricians for 35 years as a professor there. He teaches that if baby is crying at once, he wants a fresh air, just take him from bed outside, and if he stops, it means
Yes.
he's
He's
suffocated.
bored
or
and
yes.
suffocated.
Yeah. Many times, many nights, I can say, I have attended such babies. Emergencies I have attended very less in night hours, but I have attended these emergencies of the parents. The baby is crying, and baby is not sleeping, and we also could not sleep.
How to soothe them.
Yes, it was more worry about baby's cry for the parents not. And I popularly say that about my teacher, the English sir. When baby is crying, they remember pediatricians. And when we are in agony, we remember our professor. For many times, I have to take my patient to sir for advice. That was he came to my place also many times.
With regard to immunization, like when I had daughter in 1990 I delivered, limited immunization schedule,
Yes.
vaccinations were there, now many. And there are many different companies are there. And government is not supplying all the vaccinations.
In those days, almost the
Everything,
government vaccination was on government's propaganda. This only advice.
Okay.
No vaccines were available in almost in India also.
Yes.
New vaccines. But since last 20 years, our Academy of Pediatricians has taken initiative to develop our own immunization schedule in spite of this government schedule. And we started these new vaccines available all over India, and we are using it properly. But since last 5 years, almost government has also accepted our request, and they have started almost 19% vaccination in government also.
Okay.
The same vaccines are available in government also. Few vaccines they are in pipeline to accept it, but they are. And about these companies, as it is a trade marketing, there are many companies. Some are multinationals, some are indigenous. But as we are having a research papers or studies, there is not much difference in these vaccines. Only the some what you call manufacturing their companies and their strategies, marketing strategies, or some patent issues. Some vaccines are not available with all companies. They are patented to few companies.
So the efficacy of vaccine is not based on the cost of it? Not much.
Not likely that. In vaccine, proper storage and their proper delivery.
That is more
That is
important.
more important because these companies they are as per our regular studies and research papers, the results are equally good.
So just now you were mentioning about government is getting convinced about the
Yes.
immunization schedule prepared by Indian Academy of Pediatricians.
Yes.
So is it every year they make effort? Recommendations go to the government?
Yes,
Every year or once biennial?
No. Our president is on that immunization
Government
advisory
board.
committee,
Advisory.
and they are the problem of the government is fund availability because these new
Yes.
vaccines are costly, and all government companies are now almost stopped working. Previously it was only the production by the government companies for government vaccination. Now almost it is total privatization.
Yes.
So there are issues with the funding.
What about the number of vaccinations? Around how many vaccines the baby has to take in the first year? Approximately.
Now there are combinations of multiple vaccines.
Okay.
So now the pricks are coming less.
Okay.
We are giving 6 vaccines in one prick.
But is it good as a child psychologist and developmentalist? I feel why the break is not given at least 2 vaccines one day, then the body gets immune
No,
to the.
that is because of our immune system.
Uh-huh.
If
It's good it is.
Yes, if we do immunization on same day,
Uh-huh.
multiple vaccines, the development of the immunity is good.
Okay.
You have to give a gap of at least 4 to 6 weeks in between 2 vaccines. You can give 2 vaccines on same day, but there are some restrictions about the antiviral or viral illnesses and bacterial illnesses that we avoid same day. But these combinations are giving good results. That is why risks are less or rather visits are less, because the many times patients miss the vaccines because of this regular visits at the government level.
Yes.
But still the government staff is not sufficient that much to give vaccines in all population.
Based on your this long experience, can you just give 5 points to the pregnant women so that they will deliver the healthy baby and their Apgar score will be above 8? 1, 2, 3, 5 important things, because you have seen newborn babies in the hospitals and you have seen the mothers, what type of prenatal health history they had.
The first I will definitely say that is pre-marriage counseling.
Pre-
It should be made compulsory. आपण सगळीकडे असं एक आहे की जन्म कुंडली पाहून लग्न करणे,
Yeah, yeah.
गोत्र पाहून लग्न करणे. तर त्याचं आम्ही सांगतो की आरोग्य कुंडली पाहून लग्न करा.
Correct. Very good.
मुलाची आणि मुलीची आरोग्य पत्रिका पहा, because some their illnesses are there, hereditary illnesses, they can be avoided.
Yes.
The first point is that pre-marriage counseling. After marriage, before conception, you should have a very good checkup of both parents. Third is immediately after conception, you should take
Best antenatal care.
advice from the medical doctor as early as possible.
Okay. After the
After
conception.
conception, one should take medical advice earliest. The next point is the working woman. They should properly take advice how to work, how many hours you should work, and how many hours you should take rest.
Yeah.
That is very important.
They have to listen to the doctor's
Yes,
advice.
because
If she is required to take
They
bed rest,
continue-
she has to take.
continue to work till 9 months. Then problem
Provided
comes
she is
with-
having good
yes,
health.
nutrition is next factor. Proper nutrition, what you call, what they advise not to eat, but rather what to eat, that is important.
That is important.
And the next is you should have regular checkups about. Some are very worried about this sonography, some are worried about this blood test or
Nowadays, all these abnormalities,
Yes.
scans.
scans. One should take proper precautions. And last thing is have a good hospital
Delivery.
for delivery, because nowadays maximum hospitals are having a very good facilities. Even in government hospitals also we have got a good setup of NICU in Parmani also. Separate women's hospital is
Coming.
is
Okay.
already started
Okay.
since 5 years. It is dedicated to women and newborns only. And very good staff is there and very caretaking doctors as well as staff is there. So it is good for Permani people. Nowadays, if these pregnant mother or for delivery, they were referred to higher centers, Nanded, Aurangabad for complicated labors. But now in almost many private hospitals or government hospitals, all such high risk pregnancies are admitted and proper care is taken.
Doctor, apart from these diseases, what patients of accidents, home accidents, road accidents, children, or what were those common? Like recently, I'm hearing because nuclear families, if the mother is busy in the kitchen or with the computers, if she's working, the babies are falling down from the cot and had head injuries like that.
We have seen many accidents, right from simple taking coin in mouth, and that can give a respiratory problem and sudden death also.
So from crawling stage, the accidents
Yes,
are known.
right from the 9 months onwards,
Yeah.
you should take care because
Extraordinary care.
yes, even they eat some tablets,
Insects. Sometimes
medicines,
they pick up insects
Yes.
and eat.
even medicines of what you call toxic for babies if we are taken accidentally.
Yeah.
Then this what we call as fall from bed,
Bed,
yes,
staircases.
staircases.
Even the vehicles, two-wheelers,
Yes.
when they're going. So that incidence is
Yes,
it in
yes.
increasing mode?
Not increasing more, but the what you call the parents are taking care, not that much, but
In spite of that, it happens.
yes, yes.
What
When
type
it
of
happens,
health issues these children face? One is a respiratory. Is it a
they can have toxic effects like kidney problem
Mhm.
if the medicines are taken accidentally, or some what you call seeds from some fruits if are taken accidentally. That is also very commonly we see.
And this head injuries.
That is what I am telling. The head injuries are becoming very common, not in house, but the children are going outside, in school, or in playing areas. They are getting injured, and fractures are seen more because of vitamin D deficiency and osteoporosis. We never saw such amount of fractures in pediatric patients. And in head injuries, there is some natural safety to the baby skull up to the age of 5 years. Even though they get trauma, they suffer less. But after that, they are also prone to the same injury. And we are having good facility in Permani now for this CT scan, MRI, and good neurological physicians, surgeons. So that is also preventing or treating patients, babies were able to treat.
There is now a lot of discussion, especially three generations: grandparents, parents, and young parents. Young parents, parents, their grandparents. Introduction of salt, introduction of sweet, sugar in the supplementary food. They say the baby should be given supplementary food without salt and sugar. What is your take on that?
This is, I think, Western concept.
Yeah, we are
Not-
copying it.
yes.
Even I personally felt, then I thought I should
It
ask
is-
you this
It
question.
is totally misconception.
Yeah, because Indian food always had. I remember when, as a child, when I was a child, my mother, my grandparents, whatever they used to eat, little amount they used to keep to the baby, and they used to see their response.
Yes.
how much they are enjoying. If they enjoy little more,
If,
they used to offer.
if you give all test in
Yes.
first 2 years, they will definitely like everything.
Yes.
They will start eating
Everything.
If you start only giving sweets, they will not eat anything after
Yes,
that.
yes.
And in small amount or proper amount, sugar or salt is definitely required. It is
Required.
proteins
It is.
and carbohydrates and fats. These are the three ingredients we require. So just making, they are giving formulas there and then saying no sugar, no salt. That is the misconception. Whatever we eat in our
And
home, we should
especially
introduce
the food in practices in India, traditional food.
Yes, traditional
Excellent,
food.
excellent, not
Very
this
nice,
modern
very nice.
food. Because none of us used to fall sick. Rarely, very rarely I see, even in school days, high school days, college days. But now, very frequently, students also fall sick.
They almost miss their schools.
Yeah.
Almost.
Doctor, I want you to stress on this. No? Don't follow Western, this social media and Western concepts. They should seek from great grandparents if they're fortunate to have grandparents, parental experience. They can study family
Yes.
history. What did they eat and what type of health status they had? Then it has to be co-linked. Why they have to listen to one Instagram, one episode, and they take decisions on that.
Exactly. They Google or WhatsApp universities we can call.
Yeah.
Is very dangerous.
Yes.
They are showing.
Just, I feel sometimes, to make money, they want to introduce some new concepts.
Yes, yes.
These new concepts also might be wrong concepts.
Our teacher used to say about this new medicines also.
Uh-huh.
If a new medicine comes to market,
Mm.
the company started
Yes.
promoting it. जुनं ते सोनं.
Correct.
If-
Old is always good.
आपण जर जुने औषधं वापरून त्याने जर बरा होत असेल पेशंट, why to start a new medicine immediately?
Yes.
If there is problem or
Need,
if
yeah.
is there every time you start an antibiotic or every time you start antibiotic even for any illness, that is very dangerous and very problematic for that child also and for society also, because nowadays no antibiotic is available in India that can treat resistant bacteria or new infections.
Because of the misuse.
Because of the overuse,
Overuse.
misuse or not necessary when the illness is viral and you start antibiotic. And more than that, is over the counter. Even parents don't ask doctor, this medicine you have given last time, so we have given last 1 year. Every month we are giving
Repeating the same prescription.
medicine because that was giving good result. That is very
Dangerous practice.
dangerous practice, and this pharmaceutical have good profit because of their over the counter sale, and they don't care about that. In Western countries, that is good thing. Such medicines are not available there unless doctors prescribe. They cannot give same prescription repeatedly. That and other thing is that half-trained doctors or quacks in the rural area, they trained compounders go there and start practice, and they just keep the prescription of doctors and blindly follow that medicines and start practice. That is troublesome for us also. If a patient is got treated there for 15 days, 1 month, and then with complications come to us, it is very difficult to convince them or even treat them also because of this. Many times, patient came to me for a fever for 1 month, and if I say that you stop one medicine, your fever will gone. they will not be ill. And that is was the only thing that because of the medicines, patient is becoming febrile and ill.
Do you have the practice of placebo medicine to treat some parental attitudes?
The
No. Placebo effect.
Yes, yes, placebo effect is there,
Uh-huh.
but
Generally, no.
the pediatric practice,
Mhm.
just advice is more important than this giving something.
Yeah.
Even patient or parents insist for giving
Yeah.
new tonic. At that time also, if necessary and if particular single vitamin or single thing is required, then we can start. Just giving multiple tonics for years rather than give the good food.
Food. Let them get all the
Yes.
required nutrients from the food.
Because every medicine is toxic to our health.
Yes.
Even
Even the
vitamins
supplements.
or
Yes.
supplements also. But it is difficult to convince them in soft words. If you don't give, they can purchase from the.
They may go to another doctor who prescribes such
That
things.
is more possible.
I just want to say that what was Dr. Anil as a child in college days? What are the basic personality traits you carried over to the next stages of life?
As I remember from my first standard, I was a very what you call stupid student.
We don't say stupid, adventurous, naughty.
I missed my first standard without attending school.
Uh-huh.
In again in third or fourth standard, I also stopped going to school for 1 2 months. This again happened in the secondary school also once. But every time my mother came to help, and she came to school. She
Found out.
visited the teachers, convinced them, convinced me also. She never scolded me. Why you are not going? The father might have scolded me or given some
Beatings,
beatings
slaps,
also.
some slaps.
Or other relatives also.
Uh-huh.
And I was the youngest son.
Mhm.
My elder sister, two elder sisters, and an elder brother, and one eldest brother mishap happened and he expired in the age of 23.
Okay.
So that was,
What was the reason you were not going to the school?
I don't know, I'm not liking or some
Whether the teachers were very
teachers
strict?
giving some punishment or
Yeah, generally,
some,
the children don't like.
some friends have given some wrong treatment or
Mhm. Okay.
the incidents I remember in secondary school.
Mhm.
My teacher was very strict and giving punishments. Many students were having some problem with him. Once I had problem, I stopped going to school. For 15 days, I was giving some pain in abdomen or some reason and loss. One day, my mother took me to the school. As my father was in the education field, and my father's student was my teacher.
Okay.
So they were knowing very well. So he, without any punishment, adjusted me in other division, and problem was solved. And after that, my what education or
Interest in studies improved.
regulated. But during that days only, they never asked me to study. If you study for this much hours, you don't play.
Yeah, all of us had.
Where are you going? Why
Because
you
everything
don't
was
study?
learnt in the classroom
Yes.
itself. Very less
tuition.
homework.
Till 10th, no tuitions,
No tuitions, yes.
extra classes. and whatever they teach us, and we study, and then they never ask us how many marks you have got,
Yeah,
why
that
you
was
have
more important.
less marks, why
They were happy whatever we were getting.
one incident that his rank is having no result. Is rank first or rank 10th or 100th.
No value.
No value. Just you have to study. Whatever you study, you will get the marks and you will get whatever. And my elder brother was very eager to become doctor. He was 5 years
Older.
older. And he had a bad luck. In his BSc first year, the result was very tough, and he's not a single classmate become as a doctor. Yes, so he was insisting every time for my 11th, 12th. So you should go to medical. I was more inclined to engineering as a mathematics was.
Yeah, because you said you're proficient in chess.
Yes. So I was not that much serious about the studies, as his professors and teachers were the same for me also. He was.
So teachers used to compare, your brother is serious.
Yeah, he was studious. Still, nowadays, still they remember that he was a very good student and was very particular about studies. It's Ratnam sir, Mohan sir, and other departments also. But I was very.
You were also interested in sports, various
Yes.
sports, you said, games.
I have played almost all sports in our college or school days. But luckily I got MBBS admission. But at that time it was Ambazogai Medical College and Aurangabad. So with some friends I was discussing, if I got Ambazogai I will not go there. I will take engineering section. My brother might have heard that when I got Ambazogai admission, he attended with me Ambazogai Medical College, got admission, and then only he left the program. But luckily I got changed over to Aurangabad within 1 month.
On the request or
No.
just there were vacancies?
Merit basis.
Merit basis.
So it was.
So your dream
Yes.
came true.
And it was not ambition or what we call.
Yeah, but at least preference was there.
Yes, and parents were also saying that one is engineer, other
Another
should
one is
become
a
doctor. That was more tradition. But in this whole life, what you call, I started practice at the age of 25 and got married at the age of 29. Till that, my mother was very much inspiration. Her role was very
Important. What kind of values they try to inculcate in you?
They never,
Gave importance to the ranks.
never gave importance to anything. Just
Enjoy your life. Do your work.
looking at their life, we learn the things what they were doing. As a father was teacher,
Yes.
and mother was very devotional.
That is very important. The
Yes.
family culture was made like that. The child automatically imbibed many values unknowingly.
Yes. After marriage, mother totally accepted that now wife will take care of this husband. So she never interfered with our life. And in last 35 years, like mother, my wife Shubhada is taking care of this. What म्हणजे आईच्या शब्दात सांगायचं की 30 वर्ष सांभाळलं त्याला तुला आता सांभाळायचं.
So you were very emotionally attached to mom.
Yes.
Then she handed over that attachment
Yes.
bond to the wife and she requested. So in her last day she mentioned that,
Yes.
or after your marriage only told, take care of my son.
No.
in her last days.
No, no, no. And after marriage,
Okay.
she was taking care. She has taken care almost end of her life.
So she played father's role also because father was a headmaster and he was
Yes,
busy with
he was.
busy also with his work.
Yes, he was also.
Dual roles she played,
Yes,
mother and
yes.
father.
But
After marriage, you were
after
mentioned.
marriage, yes, after marriage,
She got slowly, gradually detached to you so that you get attached to your partner.
I make her to detach from me because she was emotionally very much attached. But that was not possible. She was emotionally attached till
Uh-huh.
her last breath.
Okay.
She was to say that you are taking so much care, we are not taking your care, like that. It is for every mother it is
Yeah.
common. But after that, my wife has taken everything in my life, in my practicing job. She has to help.
You had advantage because
Yes.
she's a yoga therapist and
No,
fitted very well.
She is no. She is basically a medical graduate,
Okay.
and after that she became yoga therapist. So she has to take care of this indoor hospital. When I was visiting many hospitals, she, our NSU, our admissions, she has to look after.
Besides
She-
parenting
yes.
your sons.
Parenting my sons and taking care of father and mother also.
Yeah, that
Because
is.
they they have lived up to 80 plus and good life. They, because of their attitude and their nature, they, what I say, मी त्यांच्याजवळ राहत होतो ते माझ्याजवळ
Yes,
राहत होते.
like many great people say
Yes.
that.
त्यांच्या म्हणजे I have got opportunity to join many hospitals. To mention the India hospital was my all classmates were pioneer in that hospital. They were calling me. But because of this, the parents were not ready to go out to new company.
You were talking about mother. No, Shubhada.
Yes. म्हणजे आमचे अनेक कारणावरून भांडणं जरी झाले, अनेक कारणावरून वाद जरी झाले,
She always holds the family together.
म्हणजे माझं फॅमिली असो किंवा सोसायटी असो किंवा सगळ्या गोष्टीमध्ये तिने ॲडजस्ट सगळं करून घेतल्यामुळे किंवा तिने सगळ्या गोष्टी स्वतःवर आता एक इन्सिडन्स परवाचा मी सहज सांगतो. गेल्या महिन्यातच 7 तारखेला आमचे मित्र आहेत गोविंदराव कातनेश्वरकर सर आणि आमचे भाऊजी हे दोघं खास मित्र आणि त्यांनी 75 वर्ष पूर्ण झाले म्हणून आम्ही एक संगीताचा कार्यक्रम घ्यायचं माझ्या डोक्यात आलं असंच सहज. त्या कार्यक्रमाची मी बोलणं केलं, तयारी केली, बऱ्याच जणांशी बोललो, विचार केला कुठे करावं आणि असं झालं की काही शक्य नाही आपण सोडून द्यावं असं कार्यक्रम झाला. आणि मग ते शुभदा म्हणे तुम्ही आता माझ्यावर सोडून द्या सगळं. Within 4 hours she prepared everything at home only and we have got a very grand program of this music because these both friends are very fond of music and because of them I became a good listener of music also. So I just want to give a tribute to them as a teacher or as a DJ or as a friend or whatever.
Yeah.
And just I clicked the idea to my mind, but that idea completed by Shubhada's help only and her sincerity. And this happened many times in my life.
Okay. So you are highly influenced by your mother and life partner.
And along with that, my elder sister has taken good care of me during my early childhood because mother was taking care of these 5 children and the age difference of my elder sister and myself is more than 15 years. She is now also taking everything what we call a mother's care for me also. And incidentally, she is in Parvani, so that is more helpful for me. The same thing, just I want to make special the importance of friends in my life. Since childhood till today, I got a very good friendship with many people, and every time they help me. It is not like that I help them because they are helping me. I help somebody because somebody is helping me. So if you do good things for others,
Yes.
some other person may do good thing for you.
They say no,
It is-
love begets love.
Yes, it is. Every time the teachers become my friend, the wife become my friend, the son become my
After
friend.
certain age, our children become
And
our
now
own
my
friends.
granddaughter also has become my friend.
Yes.
So that is, friendship is very important in our life.
Right.
And because in daily practice also, these friends not only helpful,
Yeah.
but your life become
More
happy
happy and
and
easier.
easier because of that. And in lastly, as just to mention the respect to my teachers at all levels. I started my practice in 1987, 5th July, at the hands of my teachers only. Primary teacher, well known for Parvani, Madhukar Shankar Shivankar. Shivankar Guruji, popularly known as the founder of this Balvidya Mandir. We are celebrating his centenary birth centenary this year. But making his program in next month. And another is secondary school headmaster, Sri M.M. Sharma. Both are now not there. But they were present for my inauguration ceremony. At that time, yes, just I called them for this function, and they were surprised to see their name on this invitation card. At that time, I could not what we call felicitate him because I was just starting practice.
Yeah, right.
So at the completion of 12 years, तर तपपूर्ती म्हणतो आपण, एक तप पूर्ण झालं की माझ्याकडे एक नागपूरचे एक शिक्षण महर्षी बाबा नंदन पवार म्हणून आले. काही म्हणजे कारण नसताना त्यांचा आमचा एक मित्र त्यांना घेऊन आला की डॉक्टरांना आपण भेटू म्हणून. त्यांचं नागपूरमध्ये खूप मोठं कार्य आहे, पालक शाळा, पालकांची शाळा, विद्यार्थ्यांना एज्युकेशन असं. आणि ते आले तर म्हणजे तुमच्या घराला गुरूंचा खूप आशीर्वाद आहे. तर मी विचार केला आपण अजून तर कोणाला गुरुमंत्र वगैरेचे प्रकार असतो तो काही आपण कोणाला केला नाही आहे. गुरु म्हणजे कोणतं, आपले शिक्षक सगळे. म्हणून मग मी असं ठरवलं की या शिक्षकांचा आपण सत्कार करूया तपपूर्तीने. आणि मग आमच्या मित्रांच्या सहकार्याने सगळ्यांच्या शुभदानी त्याच्यामध्ये खूप इनिशिएटिव्ह घेतला गेला. चांगली कल्पना आहे. आणि मग माझे आईवडील, तिच्या आईवडील आणि 60 शिक्षक या लोकांना बोलावून आम्ही एक त्यांचा सत्काराचा कार्यक्रम घेतला. त्याला ते त्यांच्यामुळे मला हे कल्पना आली. ते स्वतः प्रमुख पाहुणे म्हणून आले. त्यांनी सुद्धा मार्गदर्शन केलं. आणि इट वॉज 2000, 24 years back. And still people remember that function. त्याच्यामध्ये शिक्षकाबरोबर माझे मित्र ज्यांनी मला शिकवलं, जे ॲज ए बॅचमेट, क्लासमेट, त्यांचे काही ॲज ए योगा टीचर, आमचे चौधरी सर ॲज ए गायडन्स टू माय प्रॅक्टिस, असे एक 60 लोकांचा सत्कार त्यावेळेस केला मी. त्या सत्काराच्या वेळेस म्हणजे तो जो आशीर्वाद मिळाला, त्याच्यानंतर हे पुढचे 24 वर्षात 3 तप पूर्ण झाले, 36 वर्ष झाले. त्या आशीर्वादावर पेशंटचं आशीर्वाद आहेच आहे आणि लोकांचा सहभाग त्याच्यात असल्यामुळे नुसतं प्रॅक्टिस म्हणून नाही, पण एक आनंदी आयुष्य आपल्याला मिळालं. सरांना मी जेव्हा बोलवलं आमचे शिवणकर गुरुजी, he was my teacher up to 4th only, primary teacher.
But you will find very rarely, very few students remember their teachers and feel grateful to them.
No,
That trend
everybody
is
did, but-
slowly disappearing now. The parents are also teachers too.
Yes,
This is for
everybody.
parents, whoever have guided, all are gurus.
So he-
In everyone, you saw the friend as well as a teacher. It's a beautiful ending, Doctor. Thank you so much.
Thank you very much.
Thank you.